Now, Senator from Scott.
Mr. President, I move that Senate Bill 47 be taken from its place in the orders of the day, read for the third time by title only, and placed upon its passage.
Mr. Clerk, please report Senate Bill 47.
Senate Bill 47, an act relating to medicinal cannabis.
Senator from Scott.
I yield to the senator from Bourbon for action on the bill.
Senator from Bourbon.
Mr. President, would you please ask the clerk to report Senate Committee Substitute 1?
Mr. Clerk, please report Senate Committee Substitute number 1.
Senate Committee Sub 1 to Senate Bill 47.
Senator from Bourbon.
Move for adoption.
Matter for the body is adoption, being a second. All those in favor say aye. Opposed? Ayes have it. Senate Committee Substitute number 1 is adopted. Senator from Bourbon.
Mr. President, would you please ask the clerk to report Senate Floor Amendment 1?
Mr. Clerk, would you please report Senate Floor Amendment number 1?
Senate Floor Amendment 1 to Senate Committee Sub 1 to Senate Bill 47.
Senator from Bourbon.
Move for adoption.
Matter for the body is adoption of Senate Floor Amendment number 1. All those in favor say aye.
Aye.
Opposed? Ayes have it. Senate Floor Amendment number 1 is adopted. Senator from Bourbon.
Thank you, Mr. President. What we have before us tonight is Senate Bill 47, an act related to medical cannabis. Mr. President, it's time for Kentucky to join the other 37 states in the United States that allow medical marijuana as an option for their citizens. This bill has been discussed in this chamber for many years. My journey on this subject began about 5 or 6 years ago when I met Eric and Michelle Crawford in my district. Eric is a quadriplegic, and his main goal for years was to have another option for pain that is not as harsh as the powerful and expensive pharmaceuticals prescribed for him. Eric and Michelle filed a resolution with the Mason County Fiscal Court and asked me to look at the issue. And that's when I first got involved. I didn't intend to get into this issue. I'm now convinced that medical marijuana, if provided to our citizens through a tightly regulated system, can provide some important relief to our constituents. In dealing with numerous horrendous conditions, and those with condition in which pharmaceuticals do not provide relief or cause serious side effects. This bill has been vetted maybe more than any bill in the history of the Commonwealth. Having said that, it is understood that this is a very complex issue, and if passed, will be a work in progress. When you think about this bill, I'm asking you to ask yourself a few questions. Which is safer than medical marijuana? Is OxyContin and oxycodone safer? Will this option help some suffering Kentuckians? Will this option reduce addiction to opioids? Can this provide additional jobs for Kentuckians? Can this help with end-of-life care and give people an option that if they want medical marijuana, they're not considered a criminal? I'm convinced that Senate Bill 47 can do that. Really quickly, this is a very complex bill with 122 pages. I'm going to go through really quick and hit some high points. Marijuana is defined on page 89. The qualifying conditions are on page 4. There are 6 qualifying conditions. Any form of cancer, chronic, severe, or irretractable or debilitating pain, epilepsy, multiple sclerosis, chronic nausea or cyclical vomiting, PTSD, and importantly, item G, any other medical condition or disease for which the Kentucky Center for Cannabis says medical marijuana has efficacy. I'm going to stop right there, Mr. President, and say we set up this center a few years ago, last year, to research this issue. And we're awaiting some results from the center. And so when those come out, we'll know more, but we're not waiting. We're moving forward, and we should. The entity in Kentucky that will govern this is the Cabinet for Health and Family Services. They are the cabinet most equipped to handle this subject. 7 physicians shall be appointed to the Board of Medical Licensure. The Board of Physicians and Advisors shall recommend to the cabinet protocols for the amount of a 30-day supply. A patient under 18 shall not possess, purchase, or acquire medical cannabis without the assistance of a designated caregiver. There is limited reciprocity for visiting qualified patients. If someone comes in from another state, they can have an outside card, but they have to comply with Kentucky law. They have to apply and be approved under the Kentucky Medical Cannabis Act. The patient is limited to a 30-day supply, and all the information on medical marijuana shall go into the CASPER system. Person shall not operate cars, vessels, aircraft under the influence. And probably one of the most important components of this bill, this act shall not become effective until January 1st, 2025. This will give the cabinet plenty of time to promulgate regulations, and the legislature will be in session again to keep an eye on the regulations and make sure those are appropriate. A physician or an advanced practice registered nurse who is authorized to prescribe controlled substances shall provide written certifications for the use of medical cannabis. Once someone has a written certification, they must apply to receive a registry identification card. And the cabinet shall set up separate licenses for each of the entities that operate a cannabis business in this space. This bill is not perfect. This is not a panacea. It was never going to be perfect. But with passage, we're moving down the road, we're moving forward, we're moving along with 37 other states who in this republic are experiment stations. We are a sovereign state, we have our own ideas, and by passing this, we will say, give our citizens the opportunity to use medical cannabis. If there are no further questions, I would move for passage of Senate Bill 47 as amended by Senate Committee Substitute 1 and Senate Floor Amendment 1.
The matter before the body is passage of Senate Bill 47 as amended. Are there any members seeking recognition for the purpose of question or discussion? Seeing none. Madam Clerk, please call the roll.
Senator Berg. Senator Boswell.
Senator from Davis, please cast your vote, then explain, limited to 3 minutes.
My vote is no.
Please proceed.
I want to thank the senator for Bourbon for all the work you put in this. But I also want to thank the senator from Jefferson 37 for telling the story about your father. You talked about how this was going to, some votes are a day you're going to remember. And I believe this day, this vote is going to be a day that we're going to remember. First, this product is a violation of federal law. It's a drug, not a medicine. In the end, it's about this, money. 2, cannabis, marijuana, tetrahydrocannabinol, in my opinion, is a scourge of the earth. This bill, as written, is a disaster. For example, chronic pain is allowed. If anyone could use something for chronic pain, it's me. And I did have a waiver not to wear a tie tonight because of conditions involving my neck. Chronic pain includes everyone over 18. The allowable categories are too broad. This bill, 153 pages, says you can't smoke it. Really? Who in this room really believes that someone is going to buy a bag and not smoke it? Access to children will be increased as an unintended consequences, for example, gummies. It's destroying our youth, especially in the 15 to 20-year-old range. Kentucky is one of the unhealthiest states in the nation. Smoking, drugs, obesity, and now we are going to put medicinal cannabis into the mix. Oklahoma passed a similar bill 4 years ago. Today, 390,000 people, 10% of their population, are on this drug, and they just had a vote not to commercialize medical marijuana, any marijuana. Lastly, I urge my colleagues to vote no. If you are going to violate federal law, at least tighten up the bill to include only the critically ill.
Senator Carpenter. Senator Carroll. Senator Chambers Armstrong.
He is a no. Carroll is a no.
Senator Deneen.
Senator from Hardin, please
Explain my
cast your
vote.
vote, then explain.
I vote aye.
Please
Mr. President, I have heard from constituents. I have close friends that are dealing with MS, that deal with seizures, that deal with situations that medical cannabis may help. I live close to Fort Knox. Many soldiers suffer from PTSD. I've heard their request. And I want to congratulate the senator from Bourbon. When I first read the bill, I had a lot of concerns. Actually, I had 3 pages of concerns. But since this session has started, I've read the bill 3 times. And each time I've read it, the senator from Bourbon and others have made improvements to the framework to provide regulations and guardrails to make sure that those involved in the usage and the prescription are following guidelines that many other states have implemented. Is the bill perfect? No, it is not. I believe in the time frame we have before it becomes legal, there will be time to add amendments, to tighten up regulations, to ensure that it is the best possible way forward as we join 37 other states. With that, I'm glad to pass an aye vote.
Senator Douglas.
Senator from Jessamine, please cast your vote, then explain.
I make a no vote, Mr. President. Mr. President, I also want to thank Senator from Bourbon 27 for his hard work. And in fact, I thank all the persons in this chamber who really have, I think, thoughtfully thought through some of this. But this marijuana, it is a chemical compound that has not undergone any long or even any short time research protocols that included collection, collation of the material, assessment, review, or even any reporting of the data. The FDA has not formally approved marijuana for any medical use. Marijuana is a psychoactive drug. That means it crosses the blood-brain barrier. And when the mothers are carrying the children, it also is small enough to cross the placenta. So just think about that for a little while. A recent study, and my concern is for some of the recreational drug that may get out there. A recent study that was done in Colorado suggested that for every dollar gained in taxes, it cost them about $4.50 just to mitigate the other issues that occur as a result of the marijuana. And we're not even taxing this because it's medical, someone says. 68% of the respondents said that they had driven under the influence, and 27% admitted that they drive under the influence daily. So I guess in the end, what I want to say is, with the improved growing techniques and the increased concentration of these chemical compounds, I'm not really convinced that this drug is safe. But you know, we do have some research going on out there, and I really want to thank the University of Kentucky. I hope we'll have some other institutions doing research who will give us good information. Thank you, Mr. President.
Senator Funky Fromeyer. Senator Girdler. Senator Givens. Senator Harper Angel. Senator Higdon. Senator Howell. Senator Mays Bledsoe. Senator McDaniel.
Senator from Kenton, please cast your vote, then explain.
Cast an aye vote, Mr. President, if I can explain, please.
Please proceed.
I'm sorry, Mr. President, cast a no vote and explain. I apologize.
Please proceed.
Mr. President, I just wanted to speak briefly to a couple quick process things. Eric was down here earlier. I don't see him now. And then Jaime, who lobbies for this. And I just want to say that those are people that Kentuckians ought to be proud of. I don't agree with them on this issue. I come down in a different space. But those guys have come down here for years, and they have not engaged in subterfuge. They have not engaged in deceit. They have come down and told their story and passionately made their plea and worked on a legislative product in a hard, thorough, and thoughtful manner. They have engaged in this process, and unless I'm badly mistaken as where we're going to end up, they will find themselves successful for the first time in this chamber. And there's just certain people that you meet that even if you can't agree with them, touch you in the way that they do their work, and those two did it, and I just wanted to tell them that the Commonwealth should be proud of them. Thank you.
For the members prior to going on, interested parties to a vote are not to be on the Senate floor during the vote. To explain that, please continue, Madam Clerk.
Senator Meredith.
Senator from Grayson, please cast your vote, then explain.
I vote aye, Mr. President, and I too want to thank the senator from Montgomery for the great job he's doing on that. I can't think of anyone that I would trust more to formulate this legislation that he has, because he's very methodical. He thinks it through. He looks at every segment of this, and I know he's done his research. This vote is a journey for me since I've been here in 7 years. It's not an equal vote. You know, there's no right votes. It's just the best votes, the ones that help our constituents. And I don't know the science behind this. I truly don't, even though I was in healthcare for 40 years. But I've heard enough anecdotal experiences of people benefiting from this, especially children with seizure disorders and our Vietnam, Desert Storm, Afghan veterans who find some relief from post-traumatic stress disorder, that they say this benefits them. I don't know if it does or not. But shouldn't we show them just a little bit of mercy, that even if it's a placebo effect, if it benefits them, shouldn't we do it? You remember just a couple of years ago, 3 or 4 years ago, the late Senator C.B. Emery passed legislation called Right to Try, to allow people who were in stage 4 illnesses that could have access to clinical trials, experimental drugs that, you know, some of those, the outcomes are worse than the disease itself. But that's where I'm coming from today, is that these people that are suffering from these debilitating diseases and situations, shouldn't we show them just a little bit of mercy and let them at least try? Will this be abused by some folks? It most certainly will. But again, if we can benefit just one person, one child, I think it's worthwhile. But I think the great news is the way technology is advancing every day. I'm hoping someday we won't need this at all. But for today, I think this gives folks a sense of hope and maybe some relief. So, thank you.
Senator Mills. Senator Neal, Senator Nemes, Senator Rocky Adams, Senator Schickel,
Senator from Boone, 11. Please cast your vote, then explain.
I want to echo the sentiments of my neighbor, the senator.
Senator from Boone, could you cast your vote, please?
Yes, I vote no. I want to echo the sentiments of my neighbor, the senator from Kenton, and what he said. This is really an emotional issue for me. As you know, Mr. President, I've been around here quite a while now, and as chairman of the Licensing and Occupation Committee, about every 2 or 3 years, leadership would come to me and say, "Schickel, you got medical marijuana." And and we had, and over the years, we had those hearings. So I got to know these folks pretty well, and I developed, like the senator from Kenton, a genuine affection for them. I mean, I will never forget going down into the cafeteria and with a group, and several of them are here tonight that were in that group. But the person who was one of them has passed away, and he's a young man, and he took out a baggie of prescription drugs and dumped them on the table where we were eating lunch. And he said, I want to get away from this. I have a brain tumor. And it was such a powerful thing. I wrote a column about it at home and got all kinds of feedback about it. And so it was just such a powerful thing. But as I review it and as I see it, I just right now can't in good conscience vote for it, even though I admire these folks so much. And it looks like they're going to have a big victory tonight, and I'm happy for them.
Senator Smith,
Senator from Perry, please cast your vote, then explain, limited to 3 minutes.
Mr. President, I rise to explain my aye vote.
Please continue.
Like many here, I've watched this bill go through the progress over the years, and there's been a lot of debates. A lot of cast of characters have come through these hallways and the cafeteria to plead their case with us. When you look at this, I mean, this product is a plant that grows pretty well all over the place, a natural organic product compared to many of the synthetic products in the labs, from fentanyl to Lorceps and Lortabs and Percocets and all this. And so it's interesting when we start debating about which one is better. One is organic, the other one comes in from who knows where, and I won't get into that debate. But what I'll share with you is that I've been around here for a little while as well, and earlier in the week, many of you all saw my daughter Creston, who came on the floor, who looks fantastic, but she always didn't. She didn't always look great, and when she was little, we spent a lot of time in Johns Hopkins, the Mayo Clinic, Cincinnati Children's, knew us by heart, and the staff was always very pleasant to act like they were so happy to see us, and of course, we all dreaded being back there. But as a father with a child that went through long-term illness, I will tell you that there's not much you won't do. You know, if there's something out there and that a drug that can help you solve that, or even give them, as the doctors here will agree, even one evening of comfort, you will happily go get it and to try to help them sleep if they can. But so if this helps any of these people we've met, whether it's the children or my veterans or, you know, elderly that need it so they can increase their appetite at the nursing home and begin to eat again and gain weight and return to their health, if it does any of those things, I will accept that as a win, that we've done our job here. Thank you, Mr. President.
Senator Southworth,
Senator from Anderson, please cast your vote, then explain.
Cast an aye vote and explain, Mr. President.
Please continue.
Mr. President, I think the senator from Perry started to take the words out of my mouth, because I've explained my vote multiple times. It didn't take taking the vote to actually say it, because I started at the very basics. Genesis 1:1, in the beginning, God created the heaven and the earth. He created everything. He created the plants. And as my dad would always say, the problem with our system of medicine is that the drugs react with your body. They aren't bioavailable. They're not absorbing in and actually working with what we have. They actually clash. And that's why we have things that we call side effects. That's why we have unintended consequences. But my position has always been the natural items were created and our bodies are they work with them. Now, there are a lot of constituents that have concerns about public safety and issues that frankly are realistic and do need to be addressed. And so I find that the items in this bill address literally every single thing I have mentioned in the past 5-10 years as we've been working on this around the state. We got on page 46, which I'm not entirely sure about the science of this. I looked into it and the lab people told me that maybe we couldn't get there, but here it is on page 46, percentages of THC, milligram numbers, trying to stick with the natural and not the concentrates, not going in a direction that gets away from the way that God created it, hopefully will work for our people. Another issue I looked into, because there's a big concern about signs popping up all over the planet, that's addressed on page 47. One of my concerns that's not addressed, and that can't really be addressed in this body, but I think we should all at least be aware and tell people, last year I actually tried to write this bill. And the federal government needs to get on alert because we have laws on the books that prevent our people from safely having their gun rights. And that is a huge concern, Mr. President. It's still a concern now. We're not going to get rid of that concern until Congress gets it fixed. Now, I believe in the Second Amendment, but I don't want my constituents in court over it. I would just reiterate as I close that this is a developing process. There's a lot to get developed, but I think we have a decent foundation to start on. Schedule 1 for God's creation is wrong. That's why I can vote yes today.
Senator Stivers. Senator Storm. Senator Thayer.
Senator from Scott, please cast your vote, then explain, limited to 3 minutes.
I vote yes, Mr. President. And this is not an easy vote for me. I'm not the kind of guy who changes his mind very easily. I'm old-fashioned, a little stuck in my ways, and I have been rightly referred to as one of the strongest opponents of medical marijuana in the Senate. But there have been a lot of people over the years who may not realize it, but they have had an effect on me and have persuaded me to change my mind. Both my parents died from cancer, and they both suffered a lot of pain before their deaths. My 93-year-old grandmother suffers from debilitating back pain and bad knees and has trouble sleeping. Her solution, a shot of bourbon cream before bed and marijuana cream on her knees. There's been a lot of talk tonight about motives for why people cast their votes. It's been disappointing to hear people talk about hate when somebody doesn't vote the way they think they should. And that is so regrettable on this bill, on the bill we passed previously, because I feel like every vote here tonight is cast out of love. A love for the people of this Commonwealth. A love for the people who have come in and out of our lives, whether they're people we've known for a long time or people who have just recently come into our lives. And yes, we all start from a position of core beliefs, but we are allowed, especially the older we get, to change our minds based on the effect those people have on us. I'll say again, if you're a pot smoker and you think that this is going to be the camel's nose under the tent so you can legally smoke your pot in the Commonwealth of Kentucky, I'm not going to be your guy, and I'm never going to be your guy. But on behalf of those who suffer and can find some relief, I've come to this decision. And people have asked me why, because they know I'm a stubborn guy. Why did you change your mind? One word. Compassion. I proudly vote aye.
Senator Thomas.
Senator from Fayette 13, please cast your vote, then explain.
Thank you, Mr. President. You know, Mr. President, I started my day here.
Senator, if you could, please cast your vote.
I vote aye. I'm sorry, Mr. President. You didn't hear me. But what I wanted to say is, you know, I started my day here in the Senate with a prayer, and I'm going to recall that prayer as I end my day. We don't know whether we make the right decisions or the wrong decisions. Only God knows that. And, you know, when it comes time to make that judgment, then we'll know the answer at that time. As regard to this bill, Mr. President, I do believe that we're trying to make life better for the loved ones. I had a wife who suffered from cancer and died from cancer. I saw the continual pain that she had. I recall that, and wish I could have given her anything and everything to relieve that pain. So I only hope that I'm making the right decision today. This is something that I've been an advocate for, and only time will tell whether I'm right. But again, it's all, I know it's all in God's hands. Only God will be the ultimate judge of that. But I'm proud to vote aye with regard to this measure.
Senator Tishner.
Senator from Oldham, please cast your vote, then explain.
I vote aye.
Please continue.
I want to commend the senator from Bourbon for the work on this bill, and I would be remiss to not also recognize the representative from Oldham, 33, who spent years on this issue as well. I've tossed and turned over this issue. I've gone back and forth multiple times, and discussions have been brought in our caucus, and I've just gone back and forth quite simply. But when it comes down to it, I really have to trust the efforts that have come from our senators and our attorneys who've been working on this issue for many, many years. I've had lots of my good friends who do not support this measure. And that's a hard decision to make. I appreciate so much that we have until 2025 before this is officially on the books and legal. And we have time to tighten up what might need to be tightened up in the next session. I am not for recreational use. I'll be right there with the senator from Scott on that issue, and I will make sure we work together to keep this thing buttoned down. We've looked at states who've done it right. We've looked at states who've done it wrong. And we want to make sure we do this the best way. And the intent of it is to help people who are in need. So I vote aye. Thank you.
Senator Turner.
Senator from Harlan, please cast your vote, then explain.
Thank you, Mr. President. I cast an aye vote also, and I appreciate all the work for the Senator from Bourbon has done and everybody else that's been involved in this. I think the public needs to know that this is going to be regulated, tightly controlled. It doesn't take effect till 2025, a couple years from now before it's going to get out there. It's going to be prescription. I can take you back to 1967, 68, when the GI that came from Vietnam, it didn't have a hair on him, been the napalm. There was no pain medicine like we have today. Tylox wasn't even in existence then. And you could hear those GIs tell you, stick that marijuana in the mouth, that was the only pain relief they got. And I saw them in wheelchairs in San Antonio. So I know that the people that need pain medicine, and I've watched it as I've practiced law, represented many of them that abused it, but sometimes we got to make the decision, and this is doing it, to say, we're going to put this where the people that really need it, it's going to be doctor types prescribed. It shouldn't be abused in no way. and it's done been said by the senator from Prairie and different people, if they just want to go buy marijuana and smoke it, they can. But I've seen the help that what it does for people who really need it, for pain, that they can't get it from the Tylox, from the Oxycontin, from the Nortabs, the oxycodones, from alcohol, cocaine, everything else. I saw that. I also saw the abuse of it when a young man, 2 guys were on guard duty, ended up one shooting the other and him dying. That was the pot smoking type. That's the type that the other senators are talking about we can't have. This is good medicine prescribed, and I'm confident that it will be properly controlled and regulated. We won't have any problems with it. Thank everybody for voting for it. Thank you, Mr. President.
Senator Webb.
Senator Carter, please cast your vote, then explain.
I vote aye, Mr. President.
Please
I'm
continue.
happy to be a co-sponsor, a historical co-sponsor of this measure with the senator from Bourbon, and there's no one else that I would have had the confidence in to get this bill across the finish line in a form that's not like Oklahoma or some of our other counterparts. And I think that, Eric and Michelle are my constituents first, I guess, and I've known them and worked with them and been a supporter of this issue for many years. And it is a historic moment, and I think we can make it a good moment as we utilize an option for the population in Kentucky that needs it, and that we can do it in a responsible manner. And I look forward to doing that. Thank you.
Senator West.
Senator from Bourbon.
Explain my vote, Mr. President.
Please proceed.
I want to say that all the people that are on that board in red, I could very easily be you. This is a very complex issue. I could have argued the other side on this issue. This is one of those issues where you take out the ledger and you list the pros and cons, and it's a long list on both sides. But for me personally, the pros outweighed the cons. But I want to let everybody know I respect the senators who voted no tonight, and I understand that. Right now, I would like to say this is not my bill. This is a work product that took many, many years to get to this point. And I just want to thank a few people really quickly. Jaime Montalvo was key in drafting a lot of this and helping with this. The LRC bill drafter, Chris Joffrion, amazing person with amazing skill who may have his life back now, that he doesn't have to work on medical marijuana as much. Representative Sims, who started this process with me in Mason County 5 years ago as we filed companion bills. Representative Nemus, who I believe is here, who carried the water for a few years in the House. I'd like to thank him. And I'd like to thank most of all Eric and Michelle Crawford for their work. And him being Eric Crawford, the poster child for this bill. He was a perfect person to be an advocate for this bill in the state of Kentucky. And one other group, I'd like to thank the leadership of this chamber. Some have voted for, some have voted against. But those who voted against, you set your personal ideals aside and you allowed the will of the caucus to move forward and to come to this floor for a vote. And I thank you for that. And I vote aye. Thank you.
Senator Westerfield. Aye. Senator Wheeler.
Senator from Pike, please cast your vote, then explain.
Mr. President, explain my aye vote.
Please proceed.
Thank you, Mr. President. Like the senator from Scott, I arrived here in 2019, and I wasn't sure where I'd be on this issue. I mean, I'm a little bit younger than he is, but I grew up in the 80s. I went through the DARE campaign. I went through the Just Say No, And marijuana didn't get a really good call from me back then. You know, I was actually a young guy that liked Ronald Reagan. So getting here was a process. You know, but in talking to people and seeing people and reading the literature and talking to some of my colleagues here, it became clear to me that, you know, these issues aren't so black and white. And what it also became very clear to me was when you meet with people like Jaime Montalvo and Erica Michelle Crawford is these aren't addicts or druggies or people that are looking to break the law. These are people that are willing to work hard and make sacrifice to comply with the law. What they're looking for is a pathway forward to make sure that people can get a safe product, to get a product that is not distilled or manipulated by a drug company. What they're looking for is said by the senator from Anderson, is a natural product that in many cases has been shown to be very efficacious in dealing with a variety of ailments, such as seizures, such as pain, such as burns, lots of different things. I also talked to my father, who's a medical doctor, and he's supportive of medical marijuana. You know, we've lived right in the epicenter of the opioid crisis. We've seen what the drug manufacturers can do when they try to deal with pain, and it's not a pretty sight. I've also seen, and I'll again join with my friend, the senator from Scott, I've also seen what wholesale open marijuana can do. I visited Denver last year, and that's not a real pretty sight either. So I want to commend my friend, the senator from Bourbon, who has truly led on this issue. You know, I have been approached about, you know, perhaps carrying this bill. I went to the senator from Bourbon, and you know, it was just clear that he had such a depth of knowledge that was really only one person in this chamber that could really get it through, and that was the senator from Bourbon. I'm very happy for the folks that are getting real relief as we pass this bill today. Not a false promise based on an order, but a considered, reasoned debate by the people's legislature. And for that very reason, I vote aye.
Senator Williams.
Senator from Boone, 20. Please cast your vote, then explain.
Thank you, Mr. President. I am explaining my aye vote by saying I think every one of my children, and particularly the ones that are likely to vote for me, are no on this. I hope I can get them to vote for me. They're no because they've seen the negative effects on their friends as they were growing up. And they're very concerned about their friends. They're very concerned about this after. But their straight-laced aunt, my sister, who's a straight-laced Presbyterian, her husband, who's a 37-year physician with the Jessamine Clinic, they made me promise to be yes, to get their support on this last race. And the reason is because my sister has ALS, which is a disease that is 100% fatal, very painful, and a significant amount of loss. She testified before the committee, but I'd like to read her husband, Dr. Wayne Marlowe's brief portion of his testimony. Couldn't do that because it very aptly explains why I'm voting yes. And this is Dr. Wayne Marlowe's testimony. 3 years ago, prior to Sanders' diagnosis, in our experience, I would have stood shoulder to shoulder with many medical professionals and stated that I could see no reason for medical marijuana. We should be able to treat most any symptom with something that would be effective from our medical armamentarium, word I can't pronounce. Personal experience is a powerful teacher. I am well aware that many claims are made for the efficacy of marijuana from a myriad of sources. I can't speak to that. However, there appears to be a growing body of evidence in scientific literature from around the world suggesting that medical marijuana can be beneficial in some instances. I'm in favor of giving patients especially those with terminal illnesses, a chance to try something with little or no downside to help alleviate some miserable symptoms. Quality of life matters greatly to those whose life expectancy is significantly shortened. ALS is a disease with no wins, only progressive losses. No one escapes. Sanders' quality of life has been improved with the THC she has been using. Let's create an opportunity for a win for those suffering from those diseases where loss is your predominant experience.
Senator Wilson. Senator Wise. Senator Yates.
Mr. President.
Senator from Jefferson 37, please cast your vote, then explain.
I stand to proudly cast the last yes vote and bring this fruition. The need to stand, I got the intern here. I worked as a page back in 2002, I believe, for Senator Perry Clark. Perry Clark was in the House of Representatives then, and he talked about the need of medical marijuana. It made me nervous even talking about it back then, whether or not you could do that. And so I felt when I'm proudly standing in his seat today, I wanted to make sure I mentioned his name because he was pushing that issue when it was taboo. It was something he believed in because it was about personal experiences, about what you've seen. And it's funny how fast that can change the way we feel about different situations. It's funny also that once we start talking about marijuana, we also all of a sudden embraced each other and started about peace and love. I don't know if that's a coincidence or not. I don't know. But I am looking forward to working through administrative regs, to working out proper regs, to make sure this is done correctly. I hate that we're so far behind the rest of the country on so many things, but the beauty of that is we can learn from their mistakes and make sure we do best practices. So proud to have an aye vote and pass medical marijuana today.
Senator from Campbell, explain your vote, limited to 3 minutes.
Yes, Mr. President, to explain my vote.
Please proceed.
So when I began the process as a candidate, I knew that one of my desires to run for office was because I believe in a wellness revolution. And very early on, Northern Kentucky University pulled together the community to talk about medical marijuana. Well, I made sure that I visited. It's in my district, and I really wanted to hear. I was astounded at what I saw when I went to NKU. And as you might imagine, I did meet Eric and Michelle Crawford for the first time. But I also met several veterans that also lived in Campbell County with terrible suffering of PTSD that had been treated with so many different methods, none of those naturally occurring, grown from the earth, all created in some synthetic form. And I, very early on in raising my children, lived in California. And I really kind of took this direction towards also this wellness revolution that I would only eat food made by God. So I prescribed to that approach for many, many years. And we ate lots of fruits and vegetables and different things. But taking that fast forward to those early days of 21, and knocking door to door, and person after person, all in Campbell, Pendleton, Bracken, said, now what are you going to do about medical marijuana? And I was so surprised because though that's never been something that I've partaken of or been interested in, my district was asking, please support this. So I am very proud to be a co-sponsor of this and grateful for the heavy lifting and the hard work of the leadership to bring this to the floor, of the adjacent senator to my district as well. And I know that we're doing the right thing today to bring this forward. Thank you.
Senator from Green, just assume the chair.
Senator from Clay for the purpose of casting a vote and then explaining.
Thank you, Mr. President. I'm going to cast a no vote. And the reason I do so, some people probably know. And it's because of experiences and what I've read that I've not been convinced. But more of what I want to speak about is the fact that I don't know of anybody that's probably been more demonized about this issue than me. And so let me tell you why people shouldn't be demonized over things that they don't know what's in somebody's mind or heart. As you are well aware, about this time in 2010, I walked off the Senate floor to find out that my mother had passed from cancer, complications from cancer. Today, I stand here with a sister who just finished her 30th radiation treatment from breast cancer. But with all those things surrounding it, I've read and tried to become as well versed as you can on the topic. I have talked extensively with the senator from Bourbon about the process and how I thought the bill could be made better. But because of all the things that you come here and you experience, and I know you have, the senator from Fayette 13 has, many other people have had these experiences, that they have lost somebody to an ailment or a problem that may or may not could have been helped through the bill we're discussing tonight. But mine's not done from a perspective of having ill will or being unsympathetic. It is because, as the senator from Bourbon said, I just believe the cons outweigh the pros. But in no way is it to be deemed to be something that I think I should be demonized for, but I took this job. But maybe people need to think a little bit further before they start casting aspersions on individuals because they think they know what's in an individual's heart or their mind or their personal experiences. Thank you, Mr. President.
Any other member seeking recognition to explain their vote? Senator from Bourbon, you have about 30 seconds left, sir.
Under suspension of rules, make a quick statement, Mr. President.
Please proceed.
I made a mistake earlier with my hand scribbled notes, and I left a key person out, the senator from Christian and his work on this bill. He did a lot of work on this bill. He worked on it for 2 years, and I want to thank him for his work. Also, I would like to thank the senator from Clay for his work. Although he voted no, much of this good work product is due to his work on the bill, and I'd like to thank both of the gentlemen from this chamber. Thank you.
Very well. Any other members seeking recognition to change or explain their vote? Seeing none, there being 26 yeas, 11 nays, Senate Bill 47 as amended is passed.